Behind every statistic is a child and a family whose world has been turned upside down. To truly grasp the human cost of ER boarding, we must listen to their stories. Imagine being a 14-year-old girl brought to the ER after confessing to her parents that she doesn't want to live anymore. The initial rush of the emergency room gives way to an unnerving quiet. She is placed in a small, windowless room, stripped of her phone, her shoelaces, and the cord from her hoodie for her own safety. A hospital staff member or a security guard sits outside her door, a constant reminder that she is seen not as a patient needing comfort, but as a risk to be managed. The sounds of the ER, monitors beeping, staff shouting, are a constant, jarring soundtrack to her fear and despair. For parents, the experience is one of profound helplessness and anxiety. To truly understand the scale of this crisis, we have to look at the data, and the numbers are sobering. Recent research published in leading medical journals paints a stark picture of just how common this waiting game has become. A study analyzing pediatric emergency department visits found a dramatic increase in the amount of time children spend boarding while waiting for mental health services. Adolescents, particularly those between the ages of 12 and 17, represent the largest group of children boarding in ERs. These are critical years for development when the brain is still maturing, and negative experiences can have a lasting impact. So why is this happening? Why are our children stuck? The answer is not simple. It's a complex web of systemic failures that have been decades in the making. The most significant factor is a severe and persistent shortage of inpatient psychiatric beds, specifically for children and adolescents. Over the past several decades, there has been a nationwide trend of deinstitutionalization, moving away from large state-run psychiatric hospitals. While well-intentioned, the shift was not matched by a sufficient investment in community-based care and smaller, specialized inpatient facilities. Behind every statistic is a child and a family whose world has been turned upside down. To truly grasp the human cost of ER boarding, we must listen to their stories. Imagine being a 14-year-old girl, brought to the ER after confessing to her parents that she doesn't want to live anymore. The initial rush of the emergency room gives way to an unnerving quiet. She is placed in a small windowless room, stripped of her phone, her shoelaces, and the cord from her hoodie for her own safety. A hospital staff member or a security guard sits outside her door, a constant reminder that she is seen not as a patient needing comfort, but as a risk to be managed. The time a child spends boarding in an emergency room is not just a benign pause in their treatment. It is an active period of potential harm. The very nature of the ER environment can exacerbate the mental health crisis that brought the child there. Emergency departments are designed for high-stakes, rapid turnover care. They are loud, brightly lit, and chaotic. There is little privacy. For a child already struggling with anxiety, sensory overload, depression, or paranoia, this environment can be incredibly distressing and frightening. This is the opposite of the calm, structured, and therapeutic setting they so desperately need. This prolonged waiting period also represents a critical missed opportunity for early therapeutic intervention. While the problem is complex and deeply entrenched, it is not insurmountable. Experts in pediatric mental health, public policy, and hospital administration have identified a clear set of solutions that, if implemented together, could begin to turn the tide. The most immediate and obvious need is to increase the number of inpatient psychiatric beds for children and adolescents. This requires direct investment from both state and federal governments, as well as incentives for private hospitals to build or expand pediatric psychiatric units. The image of a child waiting days in an emergency room for mental health care should shake every one of us. This is not a distant policy issue. It is a profound moral test of our society's commitment to its youngest and most vulnerable members. Knowing the problem, understanding its causes, and seeing the path to a solution is not enough. Now, we must act. Change will not come from the top down without a powerful push from the ground up. This is a moment that calls for collective action, for a unified voice demanding that our children's mental health be treated with the urgency and seriousness it deserves. So, what can you do? Start by breaking the silence. Talk about this issue with your friends, your family, and your colleagues. Share the stories and the statistics. The more we normalize conversations about mental health, the more we chip away at the stigma that has allowed this crisis to fester in the shadows. Write to your elected officials, your city council members, your state legislators, your representatives in Congress. Ask them what they are doing to increase funding for pediatric mental health services, to expand the number of psychiatric beds, and to support the mental health workforce in your community. Your voice is a powerful tool for change. Support the organizations that are on the front lines of this fight. Donate to or volunteer with mental health advocacy groups like the National Alliance on Mental Illness or Mental Health America. These organizations are working tirelessly to lobby for policy change, provide resources to families, and raise public awareness. The children waiting in our emergency rooms do not have time for us to debate and delay. They are in crisis now. Their future and the health of our communities depends on the actions we take today. Let us be the generation that decides that waiting days for essential healthcare is unacceptable. Let us be the generation that builds a system of care that meets our children where they are, with the compassion, dignity, and immediacy they need to heal. The time to act is now.